in the gynecologic oncology world currently, there's a lot of new data coming out about PARP inhibitors, and the FDA has just recently approved multiple drugs for this indication. So that got me really curious about PARP. When doing a little bit more research, PARP is not an individual enzyme. It's not an individual protein. It belongs to a large family. And these drugs that are currently FDA approved only target a select few PARPs. And so that made me curious to figure out what are the other PARPs doing, and is there any relationship to ovarian cancer in these particular PARPs? And so that kind of initially started my search for my research. And so, the TCGA data is a huge group of genetic information on several ovarian cancer patients that I was able to comb through and look at all of the PARP data within those ovarian cancer patients. And I noticed that PARP7 had a significant number of patients that had genetic alterations, and these alterations were just showing that these genes were being amplified. PARP7 was being amplified, which caused them to have a overall benefit in survival when these patients did have amplifications of PARP7. And so that's how my initial study started.